So welcome guys. So I'm here with the yet another topper interview. So again, I think we got first rank again in the latest INISS. So the tradition continues that our students secure the topmost ranks in the premier exams of the country. I'm with Dr. Prithvi Raaj Prakash, who is our latest rank one in the recently conducted INISS. So congrats, doctor.
Yes, sir.
Congrats
Thank you,
for a
sir.
great
Thank you so
achievement.
much. Yeah.
So
Thank
could
you,
you
sir.
just introduce yourself, where you did your MBBS from, MD, which batch you belong to,
Yes, sir.
before we go ahead?
So, yes, sir. I'm from Tamil Nadu, basically. So, I've done my UG undergraduation from Coimbatore Medical College, Coimbatore. I'm the 2015 batch of the college. And then I've done my MD medicine from AIMS, New Delhi. I'm currently still doing my MD medicine. So, yes, sir.
So again, I think you're secured rank one while you're still doing your MD medicine. So again, your first attempt. So I think
Yes.
the gist of it
Yes.
is actually a majority of our toppers and those who secure ranks get in either their first attempt or either their immediate next attempt. So it's seldom do people actually get in their third or fourth attempt, but it occasionally does happen. So again, the tradition continues. Most of our toppers usually are clear their exams in their first chance. So again, the usual question is, why did you choose cardiology?
Yes, sir. So, I don't know the exact reason, but then somewhere between, like, during my second year of MD medicine, I had to choose either between cardio or gastro. So, at that point of time, I wanted to do something with interventions, basically. So, and then after we had this periphery postings with both of these departments, then I had more clarity. And then after talking to a few people, and then I had personally more interest in cardiology than gastro, so and then it became easier to choose between these two. Yes, so in the middle of my second year, I chose. I mean, I took a decision to take cardiology.
So when did you start your preparation from?
Yes, sir. So this was around the same time. So in the middle of my second year of my MD medicine. So I would say 1.5 years before, like before the exam.
So how did you approach what was your preparation strategy? Like how did you approach,
Yes,
this
sir.
INSS exams? Were you particularly focused on the INSS or were
Yeah.
you focused on the NEET SS as well?
No, so I was focused on the INESS exam from the beginning. Like I NEET SS was never there in the
I think the NEET SS of
always
your batch
INESS.
actually became a bit late.
Yes, sir.
So what was your strategy for cracking this exam?
Yes, sir. So when I initially decided to take up cardiology, then the first thing I did was I actually bought the Brownwall textbook. But then I did not start reading. I just bought it out of my personal interest. And then the next thing I did was I subscribed to Marrow, and then I started watching the videos. So and then that was the primary method of preparation. So I used to watch videos, and then around the end of my second year, I started just opening Brownwall and just seeing how whether it's actually readable or not. And then it was actually quite easy. I mean, it was easier to read than I anticipated. So it was easier to read. And then I used to watch the Marrow videos. I finished the Marrow videos, I think, by the end of my second year itself, in a span of around 6 months. And then I used to take notes, and then I used to read the notes whenever I had time. And then, for example, when I finished a topic in Marrow, I used to do the Q bank also. So by the end of 6 months, I had finished the Q. I think almost finished the Q bank once, and then watched all the videos of cardiology. And
So
then I
did
had
you
Braunwald. Yes, sir.
so did you actually finish the videos and then go to Brownwald, right?
Almost. So like towards the end, I started Brownwald. Like towards the end of the videos, I started Brownwald.
Broadword. So,
Yeah.
is it actually required that for this INSS that first of all, can you crack the INSS with just an MD medicine standard, or are you supposed to go for a super specialty standard?
Yes, sir. So what I did was like I think super specialty standard is required, but then not all the students, like many of my friends have not read Brownwald, but then they've gotten through. So, but I'm not exactly sure.
Yeah, what I
If
mean basically is
yeah,
like if you're a good MD medicine PG, is
yes,
the
sir.
typical good MD medicine PG who does
Mhm.
Harrison, who prepares well for your MD medicine. Is
Yes.
that sufficient, or should we take extra efforts? to read
we
the
yeah.
underlying specialty subject.
I think we need to take extra efforts, sir. So
Efforts.
this is for the the top five ranks. I would say that extra effort is needed. So I think Braunwald, at least some selected few important topics we'll have to read from Braunwald. Um, Even if it's not possible to cover the entire textbook, at least the important topics we'll have to read from Braunwald, and then we'll have to stick to the notes. The notes are the first, and then after that, the notes, and then the I think we'll have to read Braunwald, at least the important topics.
Yeah, please.
So yes,
Broadworld is a textbook which is actually written from a DM point of view, not from an
yes,
MD
sir.
point of view. It's
Yeah.
sometimes difficult for people to understand. So in our times there was no Marrow, no nothing like that.
Mhm,
At
yeah,
that
yeah.
time we used to read Braunwald post our MD, and
Okay.
understanding was very difficult because we
Mm,
seldom had exposure to the hardcore cardiology, and understanding was very difficult. So
yeah,
once you actually look through the lectures, once you master the lectures, it becomes much easier to read Braunwald. You get a better understanding. Once you build the foundation, it becomes a better understanding.
yeah.
So yeah, so like if you're given a chance, once if suppose you're given a chance, when do you recommend? And you've say you're a first year PG again. When do you
Mm,
recommend a first year PG? When do you recommend that you start preparing for the
sorry
INSS?
for the- Ideally, as soon as we've decided to take up the particular course, at least around the end of the second year. So
So
that
1 year preparation
that
is
should be,
sufficient.
yes, sir. 1 year preparation is sufficient.
Sufficient.
So because we
So
need time
yeah,
to, yes, sir.
yeah, please continue.
So we need time to revise also. So I would say we need to read around 60% of Cornwall at least. So it would take time for that, and to watch the videos as well as to read some of the important guidelines also. So by the end of, I mean, at least 6 months before the exam, we need to have all these things to revise. So after that, nothing should be new to read. It should be mainly revision.
Okay,
Yes.
so did you go through any particular question, the question banks? Did you
Yes.
approach MCQ problem solving?
Hmm. So
So
yes,
what
I
is your
used to
approach
do the Q
practice?
banks. I used to do the Q banks simultaneously after reading a particular topic from the videos as well as from Braunwald, mainly the videos. So I used to see the videos and then do the Q bank of that particular topic, and then I've done the Q bank I think twice, the whole Q bank twice, and then grand tests I've done in the last 2 to 3 months only. So I do not do that many
So
grand tests, but then
how
yeah.
was your rank in the grant test?
I used to get in the top three. So
So
yes, so the
fairly
grandest rank
reflective.
will mostly mirror the
Fairly,
final result, I
fairly
think.
reflective. Exactly.
Yes,
So how many questions did you attempt for your
yes.
main exams?
So my strategy before going to the exam itself was to attend as much as possible. So I had attended out of the 80 questions, 79 questions. I had left just one question.
One.
Yeah.
So how many did you get correct?
I got I had 15
An
mistakes were there.
approximation would be sufficient.
15 mistakes and then one I had left.
So I
So
think you would have got
64,
around 64, right? So
64,
again,
right?
consistently, all those people across the years who've topped the
Mm,
exam usually get through attempt more than 75 questions out of 80. So that's
mm,
very important to all future candidates that you keep on attempting maximum number of questions because you do get questions wrong. Even the
mm,
toppers, he has got around 15 questions out of 79 wrong, which is around 20, at least maybe around 17 to 18%. So you
mm.
do get questions wrong. If you attempt something like 65 questions only, you're straight away out of the race. So was time management a factor? Like, did you get enough time for the exam for
Uh,
attempting the MCQs?
I had time, sir. I had time because the MCQs were never um, too lengthy or anything. It was very short questions only. So I was able to finish around 15 minutes before the time.
So
Yes,
you would have attempted the previous question papers also, right? We have the on
yes,
the app the previous recall session. So what is your impression? Is are the standards slowly rising, or are the standards of the
uh,
questions slowly rising, or is it the same actually? So we have
I
questions
think
from
the last,
2021
yes, sir.
December.
So the standard was actually it's actually increasing only, but I think this exam
Increasing,
was slightly easier. The
easier.
this exam was
I
slightly on the easier side.
I
So
think the
yes,
reason, I mean, I agree. Since I've been seeing questions for the past from December 2021, the December 2021 pattern was pretty easy. The standards are slowly increasing. They're going on more into the subject. And I think the exception last year, what you felt last year was probably was tough was because
Yes,
you had
the
6 or 7
APS.
electrophysiology
Yes, sir.
questions.
Mhm.
And I think electrophysiology there was no question asked this time.
No, sir.
So I think
We had
it's
actually
definitely
expected that, but then yeah, it
exactly.
was
I
not.
think the standards definitely are increasing. In
Yes, sir.
fact, if you see it, if you attempt a 2024 question in 2021, you will be shocked. So the
Hmm.
standards are steadily they are keeping on increasing. I don't know what standard they will go because
Yes,
there
sir.
should be a point where you ask questions. You can't ask any question under the sun for an MD graduate.
Hmm.
So how was your interview experience?
Yes, sir. So that was actually, I was very anxious before the interview because, like, um, uh, I had no experience, and the other thing was that I didn't know what to read because, like, there is too much to read in too little time. And then, but they ask very simple questions, sir. Like, they ask only 4 questions, and then one is about thesis. So it
Did
was
you
very
attempt? Did you
yes,
before the interview we had a session, right?
mock. Yeah,
Why
yeah, I
why
attended
that's a,
the mock interview. Yes, I attended the
so
mock interview. I saw
I
the
think the
videos. Yeah.
I think from that I told you there is no point in
What?
learning for the
Yes,
exams
so I
and
had
the only
seen that.
question.
I had seen that video, but then I was not able to not read anything. So I had actually, after seeing the video, also had read too much, like spent more time in reading, but then that was not useful.
So I think
That
even the
was not
topper only got 4 questions,
useful.
out of which one
Yes,
question was thesis and
one
three
question was
questions were,
thesis.
and there
Simple
was
questions.
just three
Yes,
questions from an
straightforward
internet.
questions. Like, yeah,
Yeah,
one was about.
straightforward three. Yeah,
Yes,
please.
one was about accelerated hypertension. How would you treat accelerated hypertension?
Okay.
And then the other was how will you approach a patient with a normal ECG with hemodynamic instability with chest pain? That's all. And the last question was management of VSD. And when will
I
you
think that's
operate
a
a VSD
pretty
patient? That's all.
Yeah, pretty straightforward questions.
Yeah.
Nothing very complicated. So even for the future generations, also, I would like to say future candidates that the interview is not the crux of it. I think the probably your rank is already decided before you go and attempt the interview. So the interview is just for if you're at a borderline stage, like in order to distinguish between say something like rank 2 or rank 4, rather than rank 2 and a rank 10. So I think the main crux is you should concentrate more on your MCQs and the interview I think you can take care of it later.
Yes.
So again, so what are your future plans? Like you can choose any college in the country you want. Are you staying back with your home college, or are you planning for some other college?
I'm staying back only, sir.
Probably
Yeah,
staying back in your
yeah, I'll probably continue here. Yeah.
so before we leave, like how was your opinion on the what was your impression regarding the Marrow app, regarding the content in cardiology, regarding the question bank, regarding the grant tests, and any future suggestions for improvement probably.
Yes, sir. So, my primary source for this exam, like preparation source for the exam, was Marrow. Be it the videos, the notes, the Q bank, the grant test, everything. So, we need to stick to one important source and keep on revising that. So that is ultimately the thing which is going to help us. So, Marrow was the my most important source, and then so I would say that. Start with Marrow before going to Braunwald, so that makes it easier to read Braunwald also. And then the other thing is like try to finish the videos and the notes way before the exam, so that you have ample time to keep on revising it. So I think I would have revised the notes at least 3 times or 4 times before the exam. And the other thing was the grant tests, which are of very high quality, and also the Q bank. I've been using it since my PG preparation times. So yeah, so overall, Marrow does it best as usual. So and specifically the cardiology content is very short as well as clear. So the clarity is there. Also, it's brief as well as easy to do. And many of my actually my MD medicine colleagues who are not into cardiology, but then for the MD exam, they read topics like rheumatic fever as well as congenital heart disease. Specifically, congenital heart disease is not given properly anywhere else, even in Braunwald. So I would suggest that Marrow is very good in that, like for those topics.
Congratulations
At
to
least.
this. How
Yeah.
useful was it for you? Have you finished your practicals?
Yes, sir. Actually, it got over day before yesterday only.
Day for history. So useful is one Marrow for your clinical practice as an MD PG,
Yes. Yeah.
and number two, how useful is it for your exams?
it was very useful for my exam particularly because I had a difficult case as my practical case in long case in cardiology. It was a
What was your case?
triology of fallet case. Triology of fallet.
Okay, you had a triology of fellow.
Yes, sir.
That's a DM level case actually. So
Yeah, actually, I
that's
think
actually a DM level
among the
case.
whole list of cases, that one particular case was very difficult, and I got
I
that
think that
case.
will be definitely easy to pass then because it's definitely not an MD level case.
It was a difficult
Trilogy
case.
pilot is a DM case.
So the examiners were like they were happy with my approach, and my approach is basically from the marrow notes. So ultimately, because my only source for congenital heart disease was marrow, and Braunwald's chapter is very brief, too brief, I would say, to actually be useful for even the exam or for anything. So I would say that
Congenital.
congenital heart disease chapter in marrow is very brief and not in detail. So marrow is my primary source for congenital heart disease, the only source for congenital heart disease. So it is very helpful for my exams, sir. MD
So
practically.
congenital disease. In our days, we had to read Perloff as well as
Yeah,
Spark.
I was
Sorry.
doubling whether I should read some other textbook, but then I felt that marrow is more than enough.
Plus, if you look at VSD in Perloff, it's like just the clinical features itself is a huge description. So it's
Mhm.
difficult to read congenital heart disease, and they actually usually focus well on congenital heart disease.
Mhm.
So,
Okay.
so hopefully, you've finished your MD as of right now, and then you're entering into a new career. Cardiology is something
Mhm.
entirely different. So
Yes.
it is one of the subjects which has the least relationship to medicine. So it's not
Mhm.
something like endocrinology or rheumatology or something. And once you enter into cardiology, it's something which has a very superficial relationship to medicine. It's like
Mhm.
completely entering into a new field, and
Yes.
that it has its own challenges and it requires a certain degree of passion to pursue. So
Mhm.
hopefully, you will reach heights in cardiology, in interventional cardiology, and hopefully in the future we can meet sometime. So
Yes, sir.
thank you, Dr. Prithvi. Thank you for your very candid approach and regarding
Mhm.
how to approach and what was your preparation strategy. How did you approach the exams and the interview? So thank
Yes,
you,
sir.
Prithvi. Thank you.
Thank you, sir.